Dr. Vikki Petersen here. I wanted to talk to you a little bit about the cure for celiac disease, which is a pill. Now, it's not available yet, and unfortunately, the economic downturn has caused the two major companies that were really leading the way in this research and close to coming out with a medication. Those two companies are unfortunately not doing well, and their forward motion has stopped, which is unfortunate. But I think it's also important to realize what we're really talking about when we talk about a pill for celiac disease. Doesn't mean that with this pill you can eat whatever you want and be fine. I'm sorry, but no, it doesn't. What it does mean is that when it exists, of course, but what it will mean is for those who go out to a restaurant and they're celiac, any little bit of cross-contamination is enough to ruin their health for days, weeks, months, perhaps. There's different levels of sensitivity. I have a patient who can literally inhale something in the mall and be ill for several days. So there's a lot of different degrees, and what we realize, of course, is that when gluten is ingested, that sometimes people get digestive symptoms rather quickly, so they know they've been glutenated or glutenized, or they've been glutened. A lot of people call it a lot of different things, but they know they've had a reaction. For others, the reaction is more insidious. Perhaps it causes inflammation in the nervous system, and several days later that person feels anxious or depressed, or maybe they start getting headaches or migraines, but it's not closely after gluten ingestion for some people. For some people it's several days later. What if they get joint aches? What if it's something that's causing an autoimmune reaction of the thyroid or the liver that's pretty silent until it gets so far along that then they have a measured disease? So we have all these gradients of reactions that occur, and I think it's important to know, because a lot of people know this research is coming out, they know it's occurring. They're sitting there with fingers crossed, can't wait till that pill comes out. But I think it's important to know what that pill is for. And it's not for being able to eat whatever you want with impunity. Not even close. It's really a safety net. How the pill is being designed is a little safety net, so if there's some exposure that you tried your best to stay away from, but a little cross-contamination occurred, then that subtle amount of gluten that came in, this pill is designed to not cause that inflammatory cascade that creates all that problem. But it's not designed for a piece of pizza or a cookie or a piece of cake or some sort of indiscretion of a knowing nature. It's more for that unknown. So I think it's important to understand what we're talking about here. And I know there's some people who just say, I'm just not going to do it until that pill comes out. I'm not going to follow my diet. It's too hard. But I know that pill is coming out. Well, that pill is not what you think it is. So it really is for that type of environment. You're traveling, you're going to a restaurant, you're a little bit nervous despite all your best efforts of trying to remain gluten-free. So it comes back to the fact that this guy gluten is not good for a goodly portion of the population. And I always come back to the fact that none of us digest this protein properly, the way we're designed to digest proteins, which is taking a big protein down into medium, what's called polypeptides, and then down into individual amino acids that are very tiny. You can almost imagine Legos, right? String and string of Legos, and getting down to that tiny, smallest Lego. That would be an amino acid. And we're supposed to be able to digest proteins that way, but we can't digest that one that way. Doesn't that say something to you? That none of us as human beings is able to digest that protein properly? Certainly says a lot to me. And I think we really have to focus on that and not hold out our hopes for something that isn't even in the works. These drugs are probably still years off. We don't know how many years. It costs about $1 billion with a B to develop these drugs. On average, 10 to 15 years. There were a couple of companies that seemed pretty close until the economic downturn, and now both of those companies are actually looking potentially at bankruptcy. This is just something I've heard. I don't have any stock in these companies, certainly. This is just some research that I've done. So I think it's important to go back to the basics, which is that if you are celiac or gluten sensitive, or if you suspect you're gluten sensitive, if you've taken gluten out of your diet and you feel better, then stop eating it and do your best to avoid it as much as you possibly can, including cross-contamination. That is all we have right now. But there's certainly plenty to eat. There's a lot of varieties out there that you can enjoy and be healthy. And until next time, I wish you very good health.